Hi, I'm Hayley Chidlow, and this is my top tips for approaching a case of strangles. This case is a 3-year-old Irish sports horse who was recently purchased from a horse sale and arrived at a new livery yard 7 days ago. No quarantine or isolation period was followed when the horse arrived, but it appeared clinically normal. However, the horse has now developed a cough, increased temperature, swollen retropharyngeal lymph nodes, and purulent nasal discharge as seen in this picture. So the first step here is to work on getting a diagnosis. If you have an enlarged abscessated lymph node, then aspiration of purulent material from the lymph node is the gold standard for diagnosis. If you do not feel like there is an abscessated lymph node to sample, then a nasopharyngeal swab is easy to obtain, or you can even do a nasal swab if there is purulent nasal discharge present. You can get false negatives if there is only intermittent shedding from the guttural pouch with this technique. A nasopharyngeal wash is also fairly easy to perform and will sample a wider surface area than a nasopharyngeal swab alone. Finally, there is guttural pouch endoscopy. This is gold standard for diagnosis of subclinical carriers and for ruling out continued infection after an outbreak, but it can also be used for initial diagnosis and will allow you to identify if there are any chondroids present, which may influence your treatment plan for this horse. Now, with these samples, there are a couple of tests that we can do. PCR is preferable as it's much more sensitive than culture and has a faster turnaround time, which is important both for diagnosis of the individual horse and in terms of control of a potential strangles outbreak. Culture is easy to perform and widely available, but you may have false negatives during incubation or the early clinical phases of disease. So we've done this testing. In this case, we've performed a guttural pouch endoscopy. And as you can see here, this is just entering the guttural pouch and we're performing a lavage. So we're injecting sterile fluid and then we're going to sample it back directly out of the pouch. In terms of reducing potential contamination of the area, this is preferable than just allowing the fluid to run back out of the horse's nostrils because it will reduce contamination of the area around the horse. So instead, we just inject the fluid into the pouch directly. And as you can see, there's purulent material around. And then we're now using suction on the tube in order to withdraw a fluid sample and some of this purulent material. And now the testing comes back and it's positive. So I'm going to focus here on the next steps from a yard biosecurity perspective. So firstly, we need to isolate the affected horse. Ideally, this should be in a stable block or field remote from other horses. The yard itself should also be quarantined with no movement or horses on or off the premises. Quarantine should last for a minimum of 3 weeks past the resolution of the last clinical case and when all cases have been declared negative for Streptococcus equi. So the next step should be that the horses on the yard are separated into 3 cohorts. The red group is the horse or horses that have clinical signs of strangles. The orange group are those horses that don't have clinical signs but have had direct contact with the affected horse or indirect contact via people or equipment. And then the green group is those that have had no direct or indirect contact with the affected horse. Each of these groups should be separated to prevent any further contact. If space is limited, then you can even keep horses in the same field but use multiple rows of electric fence to prevent nose-to-nose contact. For the orange and green groups, these horses should have their temperatures taken twice daily. This is important as shedding of strangles does not usually begin until a day or 2 after the onset of pyrexia, making it possible to isolate new cases before they can transmit infection. Ideally, different people should look after the horses in each of the different groups. However, in some cases, this may not be possible, in which case owners or yard staff should start with the green horses before moving to the orange and then finally the red group. Separate equipment should also be used, with no crossover of any equipment between groups. These steps should be followed until clinical signs in all affected horses have resolved. Once clinical signs have resolved, the next step is to determine whether the affected horses and their contacts are still infectious. Testing for this should not begin until a minimum of 3 weeks since the last horse had clinical signs. If the affected horse or horses received antibiotics, then testing should not begin until 3 weeks after the last antibiotic treatment. A PCR is the ideal test for this and should be performed either on an endoscopically guided guttural pouch lavage, or if this is not possible, then nasopharyngeal washes can be performed. However, instead of just one guttural pouch lavage, a sequence of 3 nasopharyngeal washes performed a week apart over 3 weeks can be performed instead.